the various different tools you might want to consider using to try and support your patients when it comes to general practice. But can our patients actually use them? How can they find it easier to engage with the digital access agenda? And what can you do as a practice to support them? Well, in this episode, we're going to cover a new tool that will definitely help you do some of this. And I've been really impressed with it. We're going to talk to the team from Hanley Consulting and going to explain how EDATT can help you, your practice, and definitely your patients. Let's take enhance your primary care and learning. And welcome to this stream where we're looking at a tool called EDATT from Hanley Consulting. We're going to have a quick chat with the team about what it can do. I'm really excited to share this one. We've been looking at this one for a while, so let's jump in and have a look. First of all, if I can ask the team to introduce themselves. So Max, do you want to kick us off?
Yeah, hi Hussein and everybody watching. Max Gatling, product owner of EDATT at Hanley Consulting.
Cool.
Hi there.
We've got Sharon as well. Yeah.
Hi there, yeah, Sharon Hanley, Managing Director of Hanley Consulting.
Cool. So I guess first thing people are probably going to ask is what exactly is Hanley Consulting and what do you guys do?
Okay, so I think we could go right back to sort of 1998 when I sort of joined the NHS, and I was in the NHS working with general practice for about sort of 9 years, and I got stuck heavily into that from an IT perspective and actually a medical secretary as well at one point. So I took all my learnings from that. And then during the days of the choice and access and experience piece of work that was going on with Choose and Book, I then sort of took myself out of general practice and decided to be an independent contractor. And I went to Wembley and I sort of tried to sort of roll that out sort of as an independent contractor. And I carried on doing that for 11 years and sort of working and understanding how people try and use the systems that are being rolled out, you know, from national perspective, local perspective, and sort of over the years, and with obviously with the lockdown and sort of the need for digital, it really became apparent that patients needed more help with what they were trying to use. And so then came about Hanley Consulting going into the product world, and then bringing in Max as well to sort of support that and how we would use my knowledge over the 25 years to help build a product that was helpful for patients, but also really supporting what's going on in general practice.
Cool. So definitely some deep knowledge there in terms of your experience, Sharon. And then, like you said, Max jumped in, and I think he brought definitely some of the tech experience as well. Would that be a good summary?
Yeah, absolutely. So that's not a funny story, but I worked with a tech startup in Southwest London up to the pandemic and lockdown. We're actually an online marketplace for meetings and event spaces. So you can imagine it was quite apt that I moved over to healthcare. But what I brought with me was that understanding of technology and really leveraging technology to increase utilization and efficiency in organizations. So what we're looking at is multiple systems and connecting them and making them, you know, highly usable for patients, but also reducing the workload for practice staff. When I first came over in 2020, it was more as a consultant. As Sharon said, we're predominantly a services-based business, and we come from a service background, being on the ground in general practice at PCN, CCGs, as formerly they were known. And my first project was a cloud-based telephony rollout to 42 practices in Hillingdon. My second project was an online consultation tool from procurement through to deployment, staff training, which we did virtually in Clarity TeamNet. And then thirdly, it was actually once the COVID vaccination was deployed and it was the rollout, it was supporting practices to activate the AccuBook solution, configure it from the clinical system, but also communicate that to patients in the form of web guides. So it was all of that kind of experience that we had with general practice, the technologies and tools that you used, and the understanding of patients' needs and their access choices in terms of how we develop the product.
Cool. So I guess one of the things we're going to be looking then is from all of that experience, the tool that you guys have created called EDATT. So how about we find out what exactly is EDATT? And I'm kind of curious to know what it stands for as well, because I've actually forgotten since you told me.
Yeah, so in classic NHS style, you could say it's yet another acronym, but we find this one is not 3 letters. We've gone all out here, and it's actually enabling digital access through telephony, because originally we've developed this product based on patient need and data that we've gathered from surveys of over 65,000 patients back in late 2021, 2022, when we did the enhanced access surveys. And that data showed us that, yes, I think at the time 53% of patients were considered to be online, yet 88% of those patients call the practice in times of need. And what we thought is, we're doing incredible work at PCN. There's new funding streams coming in. We're hiring new roles like the digital transformation leads, which are implementing these new technologies, connecting with these services, so the PCN and ARSROL services, as well as federated services. But actually, there's just a disconnect in the patient understanding of that tool, and they're just defaulting to calling. And that's largely due to confusion with the patient. So what we've developed, we enable digital access through telephony because we integrate our product into the telephone system. We've now expanded that, and I'll go into it later in the call, to surface in websites and even in practice waiting room posters in the form of QR codes and all of that nifty technology that has been around for ages. It's just not utilized. So yeah, EDATT stands for enabling digital access through telephony. It allows us to give patients the support they need and the reminder that there's a digital tool or a digital access route for them. And then what our tool does is guides them through to that tool, whether it be an app, a digital form, or even signposting into community. And there's lots more to discuss around that at the end of the conversation.
Cool. And I definitely agree with those challenges. I mean, working in a fairly deprived area of Nottingham and stuff, but trying to support our patients to actually access the digital routes that we are being told we should be using, through NHS England and various other parts of the system, and just general modernisation can be a real challenge. And as you mentioned, having the practice team time to do that is even more of a challenge. So, having tools to support us definitely sounds like a positive thing. Shall we take a look at it and see what we've got and stuff and things? Yeah. So there we go. You want to talk us through it, Max?
Absolutely. So it was coincidental. We weren't to know what Claire Fuller was going to recommend in a Fuller stock take report, but because we'd done those patient surveys 8 to 12 months prior, it was actually the survey data that we gathered that allowed us or enabled us to develop the product that we had. And coincidentally, once the Fuller stock take report came out, that also was a similar reflection, because of course the picture or the image is the same nationally. And what the Fuller stock take report did was actually fed into the contract changes, which everybody will be aware of in March of April this year. And now we're all looking to work towards. And I can bring up a few of those examples in a second. But it was just quite apt that, by the time we've developed the product, actually ran a pilot on the product, that the contract changes came in, and this product then satisfies a lot of the needs or the national priorities that the NHS have set out. You've had a fairly comprehensive introduction to us. I just want to introduce Ellen and Paul. So Ellen is she joined us in 2021-22 basically to do the patient surveys. So her experience is all around user experience, customer engagement, and we brought her in to play that exact role, is speak to patients, find out what they want, and let's develop a tool around the patient that works for the patient and helps the patient carry out that healthcare transaction. Her role has kind of evolved. She wears multiple hats, but she is now the deployment lead for EDATT. This is a solely patient-facing tool. Yes, we send out templates internally for staff to understand what the tool is, but there's absolutely no implementation time taken up by the practice. It's a purely patient-facing product, sorry. And then Paul, he is the brains behind the operation. So he does all of the logical criteria routing, because all of the conversations within the chatbot are a combination of our experience coupled with the combinations of times and conversations we've had with practice staff, healthcare professionals, as well as patients. We've developed those conversations so that we can guide the patient to the right place. And Paul is the one that builds in all of that criteria routing, Bayesian logic, etc., to get the patient to the right place in the shortest amount of clicks. So I won't spend too much time here, but it's just a summary of the survey data that we found. We know that access is an issue, and actually awareness of those tools is an even bigger issue. They don't understand how to use them. But actually what we found and what came out of the surveys was that there's a huge digital desire in our population that I think is probably underappreciated. 70% of patients that weren't online from our survey responses actually said they would be online, they would access services digitally, so they would use your online consultation platform or submit health information data via a digital form, which can be, we now know they can be SNOMED coded, and that can reduce so much time for your practice staff. Patients want digital, they just need support in doing so. Our pilot practice that we launched EDATT in had 80% of unmet demand, and the story goes, they did try to hire. They spent 2 months recruiting 2 receptionists, hiring, training. They've all got costs, and they left after 2 weeks. So again, you know, not only did patients were patients affected by that in terms of getting through to the practice, but also staff morale took a big hit. And when you've got low morale, it's hard to retain those staff. And again, there's ongoing costs, and also underutilization of your ARS roles. As I said at the start, the PCNs have put a load of work into setting up these services, but the demand seems to just keep coming through the telephone and keep going towards the GP. Now we know, because of the contract changes, we're moving towards modern general practice and effective care navigation. And I'll highlight in a couple of slides' time where we fit in that and why we see some kind of capacity and demand issues there, and how we're solving that by automating pathways and empowering patients. Again, so yeah, fitting in line, as I said, we've developed a product which satisfies the majority of the needs when we look at moving to a modern general practice. Things like tackle the ATM rush, expanding on those referrals into those other services, self-referrals into PCN services. We can actually connect a patient from your practice telephone line via an automated chatbot. They could then be surfaced with a self-referral into, let's say, weight management. So they could go straight into your health and wellbeing coaching, social prescribing, and we've got other community services that we're embedding there as well. For example, in student populations, how to register with a new GP, which we know is commonplace across the country, but more so there, as well as sexual health clinics. Where can they get advice? How do we surface test at home ordering kits within the bot? So without actually speaking or going into the reception teams, we're actually allowing the patient to self-serve. And in that, you know, what we're doing is empowering the patient to actually understand a bit more about the health system. And so next time, potentially they won't just pick up the phone and call you, they'll call the service that they now know is there because our tool has signposted them there previously. Another one, I haven't mentioned it yet, is the NHS app. It's come on leaps and bounds. The product team over there have done a fantastic job in terms of enhancing all of the features and functionality within it. It's now even connecting into secondary care. You can check manage referrals. Patients don't know this, and even some staff don't know this yet. What we're doing with this knowledge is putting it into the chatbot, and we're guiding patients through that process. We don't send out a bulk text and tell the patient to go and download the NHS app at 6 p.m. because we know 95% of those people are traveling home, cooking dinner, putting the kids to bed, and they don't have a need for the service. If we capture them in the telephone system or on your website, they have a need. And what we can do is basically signpost them then, and you have a much higher, we call it a conversion rate, but it's a much higher kind of click-through rate, and they can then download the app from that pathway. And then lastly as well, we're working with local councils now to create that connection with the neighbourhood teams. And Sharon, I don't know if you've got anything to add there just on this slide about how the EDATT chatbot is kind of satisfying all of these.
Yeah, I think that's one of my big sort of like drivers really, is how do we reach the people that were termed, you know, hard to reach at one point, is that actually by putting the QR code in your food banks, you know, in your minority areas that where we think we're not meeting people or even got them registered with the GP, how can we encourage them? We do know they have got smartphones, a lot of them, and can we then encourage that activity in other areas outside of general practice, because they are getting missed out, and I think it's just another opportunity. And we are speaking with some of the councils about this. We've had some good sort of like interest, so we're kind of thinking, how can we make that work using the chatbot? Thanks, Max.
Sorry, I muted myself in there. And again, I don't want to go over old ground, but we know the NHS national priorities now are all around the points that I basically mentioned in the first one. You've now got a requirement, a contractual obligation to offer an assessment of need. They may not also always be an assessment of need required by the practice staff. So if we can allow the patient to self-serve and signpost them to an appropriate form of contact, whether that's an online consultation, a digital triage, or as I said, a self-referral into a different service, that demand is then taken away from general practice and is better served with faster, more direct care for the patient, but also better utilization of those services. So I mentioned the modern general practice approach. This is the diagram that was released, I think, earlier this year, and kind of where everybody needs to move to in terms of the practice. So we've got telephone calls coming in, our walk-ins, our online requests, and then we've got a care navigator here that's taking that demand and then obviously signposting back out into the community or the practice services. The issue that I see here is that we're not really effectively managing that demand. We still need to marry up the demand with the capacity. So what EDATT is actually enabling is automated digital, automated modern general practice. So we're adding a new stream, a new self-service stream for the patient to actually access healthcare services digitally themselves without needing to go into general practice. So we've added another strand here, because if the patient is already submitting a request through their online consultation tool, our, as we say, automated digital support assistant isn't really required for that patient cohort. It's fantastic if they're already doing that. There are some issues and kind of nuances, certainly in some PCNs that we've spoken with, where they're getting inappropriate requests through their online consultation tool. And actually some practices have decided to bring the EDATT tool forward in front of that. And actually, because we can filter them out before they submit requests, and that's being seen to reduce tasks for the admin teams as well. But where we're surfacing the digital support assistant is when a patient approaches a website, calls the practice, or even walks in. And I did mention the posters that we're actually sending out, fully branded for the practices, branded. For example, above a prescriptions box with a local practice, they were processing so many manual scripts every month. It was taking up a lot of time, when actually that time could be spent potentially looking into preventative care models, data quality and QoF and so on. So what we did is, because the NHS app, you can do your online prescriptions digitally, completely self-served without going into practice. So what we want to do is, if a patient goes in to submit their manual script, paper form, put it in a letterbox, we've now got a poster above that box that says, did you know you can do this online? Scan the QR code here, and then we guide them through. And of course, we track all of that data and see the usage. And there's hundreds of patients across our sites that are actually scanning that physically in the practice as well. When we look at telephone and websites, so telephone, we always give the patient the choice. So we wouldn't change the menu options, 1 for appointments, 2 for test results, 3 for prescriptions, and so on, because we want to capture that data. We want to understand why the patient is calling in. And actually, it's quite overwhelmingly, obviously, we look at 50 to 60% of calls are for appointments, but a large number are for test results and prescriptions. So let's empower patients to do that themselves, so that we can actually, our reception teams can handle calls that are more urgent and complex, that patients need to speak to a human about. And again, another obvious one is cancelling of appointments. We know that some telephony providers now have the cancel option, some of which I understand they're not fully integrated with the clinical system. They're actually just triggering an email to the receptionist to then do that task. What we say is, no, EDATT will actually enable that patient to go to the NHS app and cancel the appointment. And what that will do is obviously reduce those DNAs, which we're seeing when the practice opens, because you've got a patient that's woken up feeling better, but they're on hold for half an hour and the appointment's passed. So offering the patient the digital support to cancel the appointment at the start of the call reduces DNAs as well. And that's the line that we're going down. It's just automating it. EDATT Live is a different product that we won't cover now, but if anybody wishes to learn a bit more, feel free to contact us outside of this. And I've just broken down that diagram slightly more, because this is a question we get a lot. Oh, I'm with this cloud telephony provider, or I'm with this online consultation provider. The reason we actually developed this product is to be completely systems agnostic and work with whichever kind of tech stack or digital tools that you have, because we also know that those digital tools are likely to change, and we wouldn't want to, being on the, as Sharon would say, being on the other end of that and working in general practice and helping practices to adopt new technologies and training all of the teams on it. We know how much work goes into that, and we know how much of a pain it can be. So what we've developed is a completely systems agnostic solution that plugs into any one of your digital tools that you have. And it's completely configurable and changeable over time. So if at first we configure your online appointment bookings to go through your online consultation tool, for example, for urgent appointments, and then your routines to go through the NHS app, if, for example, the online consultation platform decided to surface routine appointments, we can just change that in the back end. So you're not doing a whole nother comms piece to your patients. We're just changing it in the back end, because the bot will appear the same in terms of the interface and usability for the patient. And again, cloud telephony, I'll show you a short video in a second of the patient flow, how we transferring patients from calling in to a self-serving chatbot on their smartphone. And I'll go through that. But essentially all we need to do is go into your telephony provider or your solution in the back end and just trigger some rules in there that will allow the patient to receive a link to launch the chatbot. I don't know, Hussein or Sharon, you had any questions or anything to add on that?
I guess you mentioned the ability for it to change and stuff and things, and it's completely system agnostic. Is that the case also with the cloud-based telephony providers? Because I can appreciate some of them, like you say, provide some of those similar services. How I guess do you prevent duplication? I guess it's probably a better question then from that point of view.
Yeah, absolutely. I think my immediate response would be we're not here to make any process longer or harder. If it's working, let's not change it. There's so many different benefits that we have. We can look into other areas. If they can cancel an appointment at the click of a button, absolutely. I don't want to come in and add any complexity or more clicks or more time for either the practice team or the patient. So let's not change what's not broken. If it's working, we don't need to tweak it. What we would then do is look at other pathways. Okay, if cancel appointments is working brilliantly, I don't want to affect that. What's your NHS app uptake like? How many calls are you getting for repeat prescriptions? How many are you processing every month? In the average amount that we're affecting or improving online prescription ordering is doubling. So I mentioned our pilot practice earlier. They had 750 prescription orders every month digitally. This is only digitally. The rest were manual. We've got them to 1,500 orders per month within the 6 months of the EDATT product live, and that's by empowering patients. Their NHS app uptake has gone from 43% to 61% in 6 months. So they're now, they've achieved their target by simply plugging in a tool and empowering the patient. And at the same time as doing that and achieving all of these targets and hitting the national priorities, they're reducing the calls that are coming into their call handlers. So then you have, reduced stress levels, freeing up the capacity to do other admin tasks. As I said, focus on preventative care. And that can potentially stem demand coming in 10 to 15 years, and they achieve more QOF points, by getting more blood pressure readings and focusing on that side of care. So, yeah, as I say, to answer your question directly, we don't change things that are working. What we would do is come in and look at a different angle, because there's so many other benefits we have. For example, expanding on self-referral pathways. We know that there's some services that have been set up, but we're working with PCNs where the website doesn't actually surface a digital form. It's still all refer by GP or refer from practice staff. So what we would do as part of our deployment, and again, this goes back to our kind of ethos of being consultants first, we then go in and we can digitize your forms for you and put them into the bot to automate that pathway. So yeah, as I said, we'll optimize every pathway we can. And certainly if there are manual processes, let's look at that, do a bit of service redesign and digitize it and fully get the patient to do the work. And that'll free up a lot of your time in general practice.
Cool. That sounds awesome, especially like you say, that ability to adapt the form so that then they can direct the patient to the right place and the right service. Integrating the form aspect of it, that sounds quite cool. Should we take a look at the other functions that you've got there?
So this was a bit of data. So this is it is a special online consultation tool. This particular one is Ask First, which it was procured by Bob ICB back in 2019. A solution I think is fantastic, because what it does is it does the digital triage, but then actually surfaces an appointment which suits the appropriateness of the problem that the patient has. So it doesn't come in as a request, it actually surfaces an appointment. So it completely removes that need for the care navigator to find an appropriate appointment or to be rejected by the system, of course. So this one, I know that there's some hesitancy around practices when I say we're going to increase the number of digital triages you get. There's a hesitancy because they think, oh, that just means more requests coming in, and I need to hire another care nav or reallocate a admin or GP even. But actually, in this instance, and this is one of the goals, is to increase that digital triage. As these triage solutions get better, more enhanced, more integrated, we'll be able to surface appointments directly. And I know there's some big players out there at the moment that are doing that. As I said, Bob ICB procured this solution in 2019. 3 years after deployment, there was, I don't want to say a low uptake, but it certainly wasn't as high as it could have been. Telephone lines, the practice still had 80% of unmet demand, yet they had this fantastic tool sitting in their arsenal, like in their store cupboard, basically, that just wasn't being utilized. We plugged EDATT in back in October 2022, and before we launched it or before we deployed it, you'd get around 34 users going into Ask First, submitting a digital triage. Patient list size hasn't changed. All of those requests, telephones were being hit right at 8 a.m. When we fast forward 6 months of EDATT being deployed, and we're signposting people from the phone call queue through to EDATT showing them how to download the Ask First app, how it works, what they can do within it. 6 months later, you've got approximately 800 patients going straight to the online consultation tool before 8 a.m. instead of calling into the practice after 8 a.m. And there's not really much more kind of evidence that I can give that we're enabling digital access. Like I said, it was pretty much considered a legacy technology. It'd been in there for 3 years, but the uptake was so poor. The patient list size is 22,000 in this practice, but only 34 online consultations submitted before 8 a.m. and 2 of those came before 6 a.m. So what we're doing is bringing the great technologies and tools that you have in your practice or across your PCN or your federation or even your ICB and bringing them to the fore and increasing utilization of them, because there's a lot of funding coming down. Capacity and access funding is going into a lot of these development funds. A lot of the tools are being procured, they're just not being utilized. The telephones are still being hit by 88% of demand in some places. What the EDATT tool does is plugs into that and redirects patients. If they do need to submit an online consultation request, we'll take them to your online consultation provider. If they don't, which in some cases they don't, we can signpost them to other services which are more appropriate before they come into your practice. We ran, so we just finished 2 pilots. This one was an RPA pilot. So we did it in partnership with Blinks Healthcare. It's a fantastic product. They've got one of their features, so they've got multiple features and kind of modules within their system. But the one that we leveraged with EDATT as part of this pilot, because RPA, it's robotic process automation, how can we further empower patients to even actually directly book an appointment from the EDATT chatbot? So what we did is partnered with Blinks's digital front door. Across, it was Whitehill Surgery within Aylesbury Central. And what we were looking at doing is how do we allow the staff to answer more calls, not have such a high missed call rate, and also how do we increase NHS app uptake and digital cancellations of appointments, thus reducing DNAs. And here's some data from that pilot. So back in May, they were answering around 30% of their calls. After enabling patients to access services digitally through the use of EDATT and Blinks, they're now answering around 50% of their calls. NHS app usage has gone kind of really well at Whitehill, and the adoption is really good. And actually the feedback and verbatim we're getting from patients is they didn't have a clue they could do any of this within an NHS app. One lady went through her medical record for 2.5 hours. She had no idea it was there. And now she knows that she can actually manage and check her referrals into hospitals and cancel appointments and order her prescriptions. And she was 77 years old and absolutely delighted with what EDATT was doing for her and all of the other patients. So we've got NHS app usage up. Again, we do get a high return user rate. And I know that sometimes if you're enabling a patient, you don't want them to return, but actually what we do and the way we've built it is they can always access this digital support bot. So yes, they may not be enabled it one way when they first call, but the next time they call in, they may choose it. Just to clarify that as a bit of a muddled sentence, but what we're seeing is that digital desire when patients call in, it's about 20% of callers when they're surfaced with the option of getting accessing the service or carrying out their transaction digitally. It's 1 in 5 patients are saying, yes, actually, I'd like to learn how to do it digitally, which is huge. If you look at the total inbound calls which come into your practice every day, say 1,000 calls, if you could automate 200 of those, remove them from the call queue, and actually better serve them by enabling them to serve themselves, you've got patient experience going up, you've got demand coming into the practice going down in terms of calls being answered, and then you've got improved staff well-being because they're not so panicked about what they need to do. And because you've got happier patients, you've got less complaints. And again, it leans towards the capacity and access funding and the capacity and access plans and the goals to free up capacity and improve access. Because of course, if you've got 20% of callers coming out of the call queue, you're then speeding up or reducing the call queue duration for the rest of those callers that need to speak to a human. And again, there's another pilot case study that we did with Poplar Grove practice of Maple PCN. I appreciate primary care is seasonal, but this is a huge drop, and we're still seeing kind of the trends going through the summer and back into this winter as well. Patients calling in for appointments, because we've got the adoption of their online consultation tool up 31%. They've now got half of their patient population have downloaded their online consultation tool and are using it as well. So it's not just about uptake, it's also about usage. So as we see the online consultation uptake going up, you've got people calling in for appointments going down and missed telephone calls also going down. What I'd like to do, Sharon, is there anything to add there or saying any questions? I'm just going to flip over and actually show lots of words and data, but I just want to show the actual patient pathway.
Okay. I think working with the pilot practice was quite insightful, really, because they really gave us a lot of time as well to understand their patients and their issues. And I think we were able to really capture their data and improve, show the benefits they were getting. So I think it was really, thanks to them, it really sort of got us started with this. But I think, yeah, Max, are you ready? Are you? Do you want to hold it up?
Yeah, sorry, just navigating back to the screen. Perfect. So this is an example of a patient calling into their GP practice. And as I said before, we surface the same options. We wouldn't really change them unless you're only offering two options, appointments and general inquiries or something. We would recommend, in order to gather that data and understand your patient behavior and demand, the only way we can manage it is if we understand it, is 1 for appointments, 2 for test results, 3 for prescriptions, and then you've got secretaries or referrals and general inquiries is how we'd kind of suggest. And we want to capture that data. So we don't change the menu options. In this example, the patient presses option 1 for appointments. And then what we would do is go into your telephone system and actually change that messaging to say, we understand you'd like to check, manage, or cancel an appointment. Did you know you can now do this digitally? Please press option 2 to receive instructions on how to do so. And that message is completely customizable as per your needs. When the patient presses option 2, the telephone system automatically sends the patient a text message. And this is a solution you may already have that will send through an automated text message out to other tools, for example, straight to your digital front door where patients can book appointments. We recently surveyed a 12,000 patient list size in South London in Wandsworth, and 51% of patients that had received an automated text directly to the online consultation tool, only 51% ended up booking an appointment. We're digging into the data a bit more about why that was. I would probably say because they recognized it was inappropriate. They actually didn't need to go through a full triage. They just needed to book a routine appointment or something, or they didn't understand how to. So what we're doing is sending the digital support assistant through, not a link straight to the tool, because actually what you'll find is that's just driving more requests that a patient potentially didn't need to do. What we need to do is surface the chatbot, have a conversation, fully automated conversation with the patient to better understand, 1, their need, 2, their level of digital literacy, how much support do we need to give them, and also how to navigate to the App Store to download the app if it's the NHS app, for example. So what you'll see on screen now is the patient's received the text. We do fully white label it. We've had some amazing creative ideas from some of our clients that instead of white labeling as the practice name, which is what we set out initially to do, just to alleviate any concerns around text message scams after COVID and so on. But actually what we've now got, I think we're launching, we've got Caprice and Knowsley, which is a fully characterized avatar with lots of pink branding, Charlie in Chelmsford, I believe, Archie in Aylesbury, and then we've just got a baby Yoda launching somewhere in London as well. So we can characterize it as per your wishes, really. It all comes included in the package. The reason we kind of looked at that angle, it was more because we've also got a federated solution. So we can actually build one bot if you run or operate multiple practices. So in Knowsley PCN in Liverpool, they actually border 2 different PCNs. What we've done is built one bot, but criteria routing is in there to understand where the patient comes from, which device they're using, which services are available to them, and getting them to that service. And it's fully customizable in that way that we can scale it up as big as you like. And also when you characterize it, have an avatar, it's great for patient engagement. And you don't need to replicate your marketing and change it. You can just do a full scale comms approach, and we would support you with that as well. So with EDATT, again, coming from a service background, we understand that patient engagement is vital in the adoption of tools. So what we give you is 3 pre-deployment templates and 3 post-deployment templates, and that's in the form of social media, email, SMS, and you can use them as you wish. I digress slightly, but if we look at the text, let's go into the bot. So the patient can just click straight into the link, and what that launches, what you'll recognize, I think the biggest thing that sticks out is there's no need for login. There's no need to download an app. We literally say we pretty much replicate what the patient has called in for, so your telephone options, but then we can extend that further because they don't have to listen to a 60-second call queue, and I think that's pretty conservative, to be fair, but they don't have to listen to all of the options and then forget it and listen to the menu again. They've got it in front of them. And we can customize this as well, depending on your local needs. With the Blinks pilot, we can offer appointments, and we can also offer submit health data. So any forms or tools that you use, iAttro's One Contact, AccuRx, Florey's, Blinks's health forms, we can embed them in here, and patients can submit health data straight in to be reviewed and then committed to record. In this flow, we'll go into, I believe it's the appointments. So what we're asking here is, what's the patient's intent? What are they presenting with? It's not necessarily the service that they'll end up in, but what do they want? And actually, we're looking at ways to track that data to find out what patients are presenting with, and then which service they're ending in. And that's a really powerful part of this product, is we can track that patient flow. How did they access it? Did they call in? Did they come in on the website? What did they present with? And then, of course, we have the data about where they ended up, and I can share that on our dashboard in just a couple of minutes. So the patients opted for appointments, and we can then break that down further. Check and cancel an appointment. That may not be the same app or service that would book an appointment for them, or check symptoms. Check and cancel, we would signpost them to the NHS app, and that's why we're getting such high increases in NHS app uptake with EDATT. But in this instance, the patient wants to book an appointment. Again, there's multiple different modes, types of appointments that a patient could potentially book, different services they could book into. We don't just want them to submit a request straight into your practice team. Let's ask them a few more questions. Do they want to book a routine, get help for symptoms, self-refer? We've now changed the terminology here. Weight management help. I need housing support, benefit support, and so on. We can break that down as granular as you like. But the point is that we need to find out a bit more about the patient, and then surface the correct endpoint, or most appropriate endpoint for that patient, which could potentially be outside of the practice services. So the patient's opted to book a routine appointment. And then what we can do, and this comes into how we're systems agnostic, is we integrate with your current technologies. We're not asking you to replace your online consultation provider, change your phone system. We build it in with it and work with the technologies you have. And what the patient can then do is click through to the digital front door. Hero Health are also another solution which you may have. We can integrate with that and surface Hero Health from this access point as well. And then the patient is then taken through to the digital front door. There we go. There was one more thing. I don't know how we are for time, Hussein, and I can't see any Q&A. What I might do, I was going to do a live demo. What I'll do is actually circulate a link that all of the viewers and people watching the recording can just go through and actually investigate the product and the chatbot live themselves. So I might circulate that after rather than go into it now. But you've seen the interface. What I'd like to do is show you the dashboard, because I think that is the latest release that we're just launching, going out to all of our existing clients. And what it's doing is bringing all of the access data together in one place. We're speaking to a lot of PCNs that are dreading March when they have to go in and try and evidence all of their improvements. They've got to sign into 6 different solutions, pull out different data points, plot it in a graph, and then write some words with it. What we're doing is actually delivering a URL link that pulls all of that into one place, showing hockey stick trends, reduced trends, highlighting key points that they'll need to pull out for their reports. And we have spoken to ICBs that have said it's acceptable for them to use a URL to demonstrate it, of course with some accompanying script, but yeah, they can use it in their reports come March, and we think that will fully bolster the 30% uplift with the local cap funding that's been announced.
So are you able to show us the dashboard?
Perfect. Yeah, thank you. And I must say, in the bottom right hand corner, you'll see powered by Primary Care Analytics. I want to thank Connor and Ray. I don't know if they've made the call, but thanks for the team over there for working with us on this. It was an idea not too long ago that we had, and they've managed to pull something together really quickly, which is quite effective. It's first iteration. We will expand on it, but we're looking to work with our existing customers on that. If there's any specific data points you want to surface, we're more than happy to implement that into the dashboard. There's a full filter. So, if you are an ICB level or federation or running multiple sites across different PCNs, you can view multiple PCNs. And then within those PCNs, you've also got multiple practices that you can drill down into the data. We bring up some highlights just of how the previous month went, how many chats were there, NHS app registrations, digital appointments, which we work with you to surface, basically, with Knowsley in particular, back then weren't surfacing too many appointments digitally. What we went in and helped them do was actually surface them through the NHS app. Their NHS app uptake has skyrocketed, but also so has their digital appointments, which leans into the national priorities. We're also looking to quantify everything we do. Every pathway that's automated or a patient's self-served, every app that's downloaded or telephone call that's been avoided, that's time saved for your practice staff. We want to quantify that. And what we've got is tabs that show that as well. We've broken it down into different access points. So you've got the bot usage data. I think it's really important. Why are people going to the bot? As you can see, an overwhelming majority for appointments, but actually it's quite surprising how many people are going to the bot for their prescriptions. So 12% of Poplar Grove patients, when they come to the bot, they want to learn how to order their prescriptions online. And again, they've doubled their monthly online prescription orders, saving, I think we calculated 5.5 days a month of admin time. So I want to show some data from another site there. In terms of reducing admin time, so we use the bot data. So which pathways are they using? How many of those are there in a set month? And what's the time saved? For example, it might take we do speak to practice teams on this to quantify it, but it may take 3 to 5 minutes to check, cancel, or book an appointment for a practice staff. So we've done a calculation there. General inquiries varies, but we've put 15 minutes against it. No, sorry, 5 minutes. I think we've put 5 minutes against most of these. And then what we're pulling out of that is how many days has the practice team actually saved, and how has that changed over time, pretty much. So yeah, September saving over 6 days of admin time was huge. And as we get more data, we can iterate on the calculations we're using. I just want to jump into so NHS app usage. So we do mark on the graphs when the bot went live. So Southmead went live in September. And as you can see, immediately, it actually went live 21st of September. And we had about 24 registrations since that date, and 25 for the month in total, but a huge spike. If we look in the bottom, again, it's not all about uptake, it's about usage. We know that 60% of the population, I'll say 50% of the population downloaded the NHS app to get to Alicante for 2 weeks 2 years ago, but they haven't been back since. What we want to do by surfacing the EDATT chatbot and guiding patients back to the NHS app when they present with a need, like test results, prescriptions, or even an appointment, remind them that the NHS app is there, and then we show them how to use it. So what you can see, if I go to cancelled, what you can see is a big spike when EDATT was launched. So patients that are calling in to cancel their appointments, and we remind them on the phone queue that they can do this digitally, lots of them are opting for that, and lots of them are actually going into the NHS app and doing that. Repeat prescriptions also on the rise, and then we've got appointments booked. Again, we haven't changed. I don't believe we've changed at Southmead how many appointments they're surfacing. It's all about the signposting, and that's what we're doing. Signposting at the point of need to the NHS app, and patients are going to book it. We have got a color-coded kind of indication top right. Southmead are doing well, very well. So 68% of their practice are online. If you are below the 60%, it will go orange. If you're below 50%, it will go red. And that's the driver that we're pushing for, and that's what we're seeing. Is there any questions for saying, just while I bound around into other areas?
Yeah, definitely. So we've got quite a few questions coming through. So I guess we covered everything from the dashboard that you wanted to share, and then probably go to the questions from.
Yeah, I'll just go. So reducing telephone demand, we are pulling in telephone demand as well. We want to show which options people are choosing, what the digital desire is, and what the average call queue is, and how that's changing. Staff well-being, we're tweaking this. We appreciate it. It doesn't look as nice as it could, but the data there is telling. We want to find out. We do survey your staff, included in EDATT package. We do survey your staff in a small pulse survey before we launch EDATT, and then 6 months after EDATT has been launched, and we plot that data in here. We're just going to look at ways to better display that. So don't take this as gospel, but it's all of the things we're trying to look at to help you achieve your QoF points, capacity and access, and basically just make your practice more enjoyable to work in. One of the biggest additions we've had more recently, now that we're signposting into community from the chatbot, is how do we measure that? All of these services are localized. Every time we launch our product, our consultant mode comes on. We're very localized. We meet with you as a practice and as a PCN. We do a discovery phase around your services that you're offering, your current processes, and how do we improve it or automate it. And then what we can do is connect into those services that you're using. We've got lots of PCNs at the moment that are procuring new social prescribing apps. We can just plug into that, show people how to download it, show people how to use it, and increase utilization. As I said, there's lots of inefficiencies across kind of primary care where digital is concerned, and there's also a knowledge gap or a divide in what the ICBs or the PCNs are looking to deploy and what the patients understand where to go and how to use them. And that's the gap that we're plugging, but also more importantly, we're measuring that. Okay, so how many have we signposted to PALS or sexual health service from our bot this month? And this data is, yeah, it works into the NHS national priorities quite nicely. Yeah, that's probably all on the dashboard. Hussein, I'd love to get some questions and answers in, if possible.
Definitely, we've had a few come through. So first of all, thank you for that. It's a really detailed tool, and I like the way that it, like you say, it navigates patients through the different aspects of the practice without necessarily putting up more blocks and more, passwords and all those kind of things to prevent it from happening. And that can be really important in terms of engaging the tool and stuff and things. I guess from that point, obviously, it does at some point need to capture the patient information to book the process and stuff, and that's all through the NHS app. Just to be clear on that point, isn't it, in terms of the login and that kind of stuff?
Yeah, we've realised that let's just verify the patient when we need to do it. If you've launched self-referral forms on your website, patients don't actually go through a verification process. If you've got that form in place, we'll surface it. The patient may just be coming for some advice from the NHS website. We don't need them to, we don't need to introduce a blocker, which may deter them and then make them call again. So yeah, we verify the patient in the tool that they go to, if it is a tool, because if it's a website, we surface that information freely.
Cool. Okay. And I know we've had a fair few questions come through. I know I've got some extra ones as well. I guess the first one that came through was from Amit. So he's simply asking, what's the cost? What's the price and stuff?
Yeah. Hi, Amit. I'm pleased you could join today. So the EDATT product is 24 pence per patient, but that comes with the full wraparound service. So 24 pence per patient per year, in line with NHS funding streams. We looked at a few different models, but we believe, yeah. And when we look at the capacity and access funding that we can basically guarantee, the dashboard that we now introduced, we see the return on investment to be between 10 and 15 times. That's looking at a financial costing model. Of course, we've got the improvements in staff wellbeing, improvements in patient experience and engagement and adoption of these tools that we're already ever funded so much in the last 2-3 years.
Cool. I guess to put that in some context, if you look at 10,000 patient practice, that's £2,400 per year. That is considerably less than the cost for a receptionist, in my view, or having a digital care coordinator to do some of this directly for your practice and stuff. So I think there are definitely, in my view, some savings there to be made. Sarah's come up with an interesting question, and definitely one that I'd be keen for you to answer. So does the dashboard show where the bot users come from, i.e. is it via the QR code from the practice, from the phone when they call, or from the practice website, to see which methods are proving more successful from the patient engagement point of view?
Yeah, absolutely. So we do. Hi, Sarah, by the way, long time. Yeah, we do. We capture that. At the moment, it's a good question. So what we do, the bot understands it's a shame I didn't get into it, but the bot understands the device that the patient is using. What we've done in every pathway is we've reduced that confusion for the patient. We don't bombard them with questions about, are you on a phone? Are you on a computer? The bot understands which device they're on, and which means it makes it easier for the patient, less clicks, less choice. So we can support the patient in the way that they need. For example, if they're on a phone, we know they're on a phone, so we can surface a link straight to the App Store or the Play Store. We know if they're on an iOS device or a Google phone or an Android phone, so we know which store to send them to. We don't ask them questions on that. The other side of that, and understanding all of the device they're accessing us from, or the referral page that we call it, is that we can track that data as well. So absolutely, Sarah, we've captured all of that data. We do display the mode. So we display whether it's mobile or desktop. We could also pull out, we do, the way that we kind of group the patients and their usage or uptake across practices is the site they've accessed from. So absolutely, we could integrate that. The QR code scanning is a fantastic point. And I'm going to nod over at my product team here to take a note of that, because we could absolutely introduce that, because we do capture it. So thanks, Sarah. That's a good point.
Awesome, thank you. And another question from Amit. So he's asking about if a patient does engage with the bot and then hangs up and then chooses an option that requires them to speak to reception, does that bring them back into the core queue, or do they start afresh? A bit of clarity would be useful.
Yeah, no, it's a great question. It comes up often, so I'm going to answer it in probably 2 or 3 parts, if that's okay, if we've got time. But I'll try and be quick. So immediately we do get that question a lot when I'm speaking with practices. If the patient chooses to receive the text and go to the bot route, can they stay in the call queue? They can. But when it comes to actually 100% of people that have deployed EDATT said if the patient chooses digital, let's send them digital. I understand there's a slight concern there and frustration with the patient. We do speak to between 20 and 50 patients every week, and we haven't heard that frustration as yet. But what we are looking is actually, instead of asking the patient, let's look at some data. So we're working with telephony providers around giving us some reports around if a patient calls in, then receives the EDATT text message, and then calls back in within 2 hours, we could deem that as an unsuccessful bot journey or bot transaction, and that the patients had to call back in. To answer your question directly, Amit, around the is the patient left in the call queue? They're not, but they can be. They can be left in hold while they go through the bot. It's up to you locally when we do the discovery phase and the deployment, or the development, I should say. We can either build it in or remove it. So that's down to preference, really.
And I guess it has pros and cons as well, isn't it? By keeping them on the call queue, have to recognise the fact that maybe still be costing them something to call you, and particularly in deprived areas where patients may not have contracts, where it's unlimited and stuff. Actually, that's costing them from the perspective of having to access the practice, particularly depending on what types of phone lines and stuff practices use and things and stuff.
And if a patient has opted, so we can see around 1 in 5, if they have opted digital, it suggests that they are happy to go digital. So let's take them digital and empower them that way, and then let's get the people behind them in the queue through faster, because they evidently have heard the same message but have chosen not to go digital.
Cool. So I've asked some questions to our YouTube viewers, because I've got the ability now to do that and stuff. And one of the questions I asked them at the start of the stream was, which type of patients do you feel need the most help with digital onboarding? And the answer that came through the most was non-English speaking. So how can EDATT help particularly those non-English speaking patients? So I'm particularly thinking of those verbal languages and stuff. But I guess, other options in terms of patients who can't hear and etc. and stuff. How can it help those?
Yeah, so it's a fantastic question. A really good place to kind of end the demo, I think, is around our product roadmap and where we're going. So at the moment, because we're predefined conversations, if you have a local need, for example, we're working with PCNs down on the south coast, high Portuguese population, in the north, or Chinese speaking, we can pre-build the conversations in multiple languages. That's not a problem. We would just get that signed off and approved before we go live with it. So in terms of improving access for non-English speakers, we can do it. At the moment, it's just a slightly longer process for us to get the assurances, but not an issue at all from a technical standpoint. What we're looking at doing, and we're actually on our way to building at the moment, is some more third-party integrations. So leveraging services like Microsoft natural language processing. So those that potentially with poor sight, they could potentially speak into the bot. We're also introducing other APIs. So we've got speech recognition, voice recognition, but actually we're going to build. We don't want to integrate, and I don't want to concern anybody. We're not integrating with large language models around the world, so we wouldn't implement or integrate with the likes of ChatGPT, as we know when we watch the news. It's not about that. It's more about understanding the patient's intent without making them choose from a list of 10. They can actually type what they feel or say what they feel in a language that they speak, and we can actually use integration services with APIs, and I won't get too technical, but it can actually then surface the right information or start the right pathway to ensure that patient gets the care they need in the language they speak.
Cool. Okay, so we've just got a few more minutes, and I do have a few more questions to get through and stuff. In terms of if somebody was keen to start using EDATT for their practice, for their network, that kind of stuff, what kind of onboarding time are they looking at in terms of having that first contact to having the tool up and running for their patients?
Yeah, great question. It's something we actually pride ourselves on, is the not deployment speed, but also the ease. We feel, as I always say it, we've been on that side of the fence in general practice and supported teams of people, whether it's in a practice, a PCN, and the reception team, care navigators, in utilizing these products or learning a new tool, configuring it and deploying it. None of that is required. it would be slightly counterintuitive for us to develop a product that saves you all of this time, but will take you 3 months of your time to deploy it, right? So the model or the approach we have, it's completely hands off. The moment, if you wanted to proceed to deploy EDATT, you sign the contract with us. We send you a form. That form basically gathers your information, takes 10 minutes to complete, which telephone provider do you use, which online consultation provider do you use, what Rs roles or PCN services do you have, and which community services do you have. That helps us gauge an understanding of what we need to build. Then we would have a kickoff meeting. This is probably in the first 5 days, the kickoff meeting. We share ideas. We know your tech stack because you've told us what you're using. We can say, oh, did you know that does that and that does that? And we do that whole piece, and knowledge sharing. Oh, why don't you do this? Really to make the most of each of these tools that you've got. And then from the kickoff meeting, we actually come away from that meeting. It's a 1-hour meeting. We come away from it and build your prototype bot. And we can do that within 7 to 10 days, connect it with all the services you like, and have it back to you for testing about 2 weeks into the deployment. The only time, obviously, we know that there's some practices of clients that are time poor. If you want to test that product, you can go through it. It sometimes takes practices 2 weeks to come back with their response to say, great, go ahead, or can we tweak this? If you received the test bot and you came back and said it was okay that day, we can push it live the next day. So deployment time, I would say on average 21 days. There's no reason why we couldn't get live in 2 weeks. Some have been delayed to 4 weeks because they just want to tweak some pathways and customize them. But yeah, it's completely hands off. And we say within a month, you'll be live with the chatbot across website, in your telephone system, and even posters in your waiting room.
Cool. And you mentioned obviously the ability to adapt to whatever providers practices use and that kind of stuff. I guess what is the time frame for making those kind of changes? And I guess not only am I thinking about when a practice actively makes those changes, but I guess also with some of those, for example, the online consultation providers, they may make changes in the back end that require other kind of changes to happen. Have you got timeframes for what those would be and that kind of stuff?
Yeah, so we're extremely responsive to the practice, or if the online consultation provider makes a change that we're not aware of, or it's more to do with the practice's changes. If the practice wants to go live with a new appointment, and I didn't really explain this well earlier, or I didn't explain it at all. Within the bot, when a patient goes through for routine appointments, we may only start out with offering 3 types of routine appointments. Your kind of common cervical smears, flu bookings, and COVID vaccinations, let's say. There is an option where the patient can say, I want to book something else. And the patient can then complete a form. We gather that data and feed it back to the practice and say, oh, did you know you've had like 60 requests for baby IMS to book digitally? Why don't we look at launching that pathway and digital option for that? So we use data to actually rebuild pathways in the practice and surface it in the bot. And that data is all fed back to you as and when you want it. We don't ping off emails every time a form's submitted. That comes to us. We maintain it. We can put it into the dashboard. We can share it with you in our monthly calls. And that all lends itself to making data-led decisions and designing services around data that your patients are giving you. Again, if you look at the quality improvement modules within QoF, you can achieve about 64 QoF points with EDATT by following, the processes that we've put in place. Because as I said, we've come from the consulting side. We know what's required, what our objectives are, and what we can achieve. Again, roundabout way to answer your question, Hussein. We're very responsive. If you want to go live with a new pathway, you can raise a ticket by emailing support@hanleyconsulting.co.uk, or you can pick up the phone, drop a WhatsApp, or call us, and we can put that ticket in the system for you. We would like to get, if the pathway needs redesigning, it can take 2 to 3 days. If it's something that we've got designed in another location, another practice, we just embed it within the same day. That's not an issue.
Awesome. Cool. So I guess if people are interested in having a look at the EDATT tool, and particularly some of the other stuff that you guys do at Hanley Consulting, I think the best place for them to go is the website. Is that correct?
Yes. Yeah. All of the information is on the website. If you go into services and go down to enabling digital access, there's also a link to book a demo if you want to do a one-to-one. And then we can talk about your more local needs. That's not a problem at all. And we've actually just launched a services marketplace. For too long, we speak to clients, they didn't know that they could survey their full patient cohort with the click of a button. So yeah, go to the services marketplace. We can survey your patients for you. We can do logo design, do a kind of a configuration check of your telephone system, audit any products you have. So those are on the services side. They all lend themselves to EDATT So, surveying patients before and after is really good. Friends and family tests, you're now targeted to increase the number of responses you're getting there. We've just gone live on a friends and family test pathway in the bot, actually, which we're deploying to multiple practices and PCNs to help them hit their figures as well. So you need a bit more information. It is all on the website.
Awesome, cool, and thank you both of you for sharing this tool. I think it is an amazing kind of thing in terms of how it's going to help patients, definitely in terms of navigating their practice so much more effective, because there are so many new services and different types of services that practices have. So to understand that more clearer, and like you say, supporting those patients who are to access the digital options, because it can just make it so much more easier for them, and definitely for practices in terms of taking some of that pressure, that workload, that kind of stress of trying to deal with it all away from the in-house team, because like you say, they sit even before they contact the practice and stuff, and that's the part that I really like about the system. So thank you to come and share it with us and stuff. As I said, I've been asking some questions, so there seems to be some interested people on the voting panel and stuff, so saying they do want to know more about it, so hopefully they will be contacting you. As you mentioned, have a look at hanleyconsulting.co.uk, and as always, we're going to be here to help enhance your primary care and learning. We will catch you all in the next channel. See you later.
Thank you all.
Thank you all.